Okay, something else that you're going to become accustomed to is how staff are selected, developed, and evaluated. So, if the quality of care is dependent on the quality and talents of staff, selecting, developing, and evaluating staff is actually a fundamental and critical part of the process. This is usually the responsibility of the manager and involves the staff input as well. So staff are asked for their input. It's not just the manager's decision. Here's a list of things that you need to know. So why position descriptions are important. So it tells you what are going to be your responsibilities, what is expected of you. So please make sure that you look at those carefully so that when you do apply for a job, you understand what is expected of you at that time, and they describe all your responsibilities. The other is how to screen and select staff. So if you're there, it's not because someone's, oh, they're cute or they're funny. Are they a good nurse? Are they reliable? Okay, what is their knowledge level? What is their experience? And then what to expect from coaching strategies. So how are we going to orient them, get them ready, and then how to effectively prepare for performance appraisals. And we'll talk a little about this when we do your portfolios, but it's actually adding to your portfolios, keeping something on a computer or your phone, notes of things that you've done, conferences, seminars, committees you participated on, something that you may have worked on to change for the hospital or your unit or your office. So those types of things they want to see. But the other thing they look at is how well you get along with others. Are you dependable? Do you get your work done in time? Do you call out a lot? So those are the types of things they're going to look at. This is from your textbook, and it's the theory of roles. So this information puts the idea of how selecting, developing, and developing staff into a context of a role theory. So you can look that over. A role acquisition, this is how someone takes on a new role. This aspect focuses on how to perform and what is expected. Role clarity refers to distinguishing the role from that of others. So this is an aspect of role development, and it refers to task as seeing how the role of a staff nurse is in a hospital A, and how does that differ from the staff nurse in hospital B. It can also relate to what differences exist between serving as a charge nurse as opposed to being a staff nurse or nurse manager. So many people think of this aspect as more of a clarification of whose job is what. Role performance relates to how the role is actually enacted. So legal and organizational parameters are established by law and the employer, but the insight of the role usually comes from the individual. So when opinions arise between two staff members about what to do next or how to approach a problem, these differences may be coming from how an individual believes he or she must perform his or her role. So again, there can be a role conflict going on there as well. Who does what? Who is responsible for what? I'm going to go through a couple of other ones too about ambiguity and coaching, but sometimes there is that conflict. Who does what? Who's responsible for here or there? At my old hospital, I was responsible for this, but when you come somewhere else, maybe somebody else is responsible for something. That was the same role you had in the past, and now it's not your responsibility. Role ambiguity causes confusion and misunderstanding, and it actually can halt information or at least impair it. And so employees need to be very clear about expectations of people's roles, what is expected of them, and how are they supposed to contribute to the unit. Acquisition of the role is very time dependent, and so knowing what is your responsibility for that position and what is expected of you is going to be very, very important. When it comes to coaching, this is the development, how people are developed or oriented. You can have an individual who is known as the orientee or the mentor, or it may be a whole group and maybe they mentor or are coached by several different people on that unit. It does help with team building because you become part of a team, and it also helps you to have optimal performance. And what they mean by that is everyone has their own strengths, and so you can pull from each person's strengths. And then also too, you get to learn how the behavior or how the manager operates, and so that can be very helpful as well. So how do you avoid role issues? Be wise about who you choose. Make sure that your staff is being developed and become a team, and you utilize everyone's strengths, and everyone is treated and evaluated fairly. So the acquisition of a role is time sensitive. The role of the manager and other staff, such as a case manager and all the staff, all that relationship should be very open and honest about how each role is seen, what the expectations are of each other, and whether or not the performance is going to match the expectations. Maybe you had high expectations for someone and their performance is not what you had hoped for. So again, this can cause a lot of issues. So it's very important that you understand who it is that you're hiring or who you're working with. There's two critical points about position descriptions, and it's that it must reflect current practice guidelines, and other staffs must be supervised and their descriptions of their responsibilities. So position descriptions have to be analyzed on a regular basis to be sure that they reflect what is accurate for practice expectations. If they aren't reviewed on a regular basis, they must at least be reviewed before a position is opened for applicants to see if this is really what the needs are, or maybe you need to add to those needs. Advertising one thing and then really expecting another puts actually your organization at high risk. Whatever position you hold, you need to understand position descriptions beyond your own to be sure that you are working appropriately within the full context of the position and other positions, especially if you're going to be delegating as well. So that can be very, very important. As far as the manager's role, position descriptions play an important role in each of the areas of selecting, developing, and evaluating your staff. As I stated before, position descriptions must be reviewed before applicants for position are seeked out. A set of standard questions should be used with all the applicants, and these questions should derive from the position descriptions. The purpose of this is that the interviewers should be able to garner information that can be compared across candidates to determine the best fit of an applicant with the available position. When you're developing staff, position descriptions are going to serve to guide the educational efforts. So in other words, if an individual does not meet the performance expectations of the role, this deficiency, if educational, becomes the basis for a remediation program. If the insufficiencies emerge because of changes in a set of position descriptions, the discrepancies form the basis of a reorientation to the role type of program. If an individual is changing positions, differences between the two position descriptions indicate where coaching or professional development needs need to be geared. When you're evaluating staff, obviously this has to be based on common understanding of what performances should be. Again, position descriptions form the basis for determining how able an individual is in meeting the stated expectations. So for an example, a group of nurses is not meeting a particular expectation. The manager must ask if Institutional failure did not make clear what is expected of them, or if some disincentive to perform the role function was present. So the manager should also consider if some change occurred that basically caused the position description to be outdated. So each of these areas require that the manager is actively engaged in the coaching process. Why do you need to know that? Because you are going to be in that same position. You're going to be looking at job descriptions and finding out what is what are the expectations of you. And so it's important that you know what goes in behind that when they're hiring you as well. A little insight here about the interviewer. They're going to look over everything you have sent in, and they're even going to look at spelling, grammar, your application, your history, where you've worked before, or if you've been a job hopper. They're going to look at your previous jobs, your education, volunteer work, and so forth. Then they're going to prepare for the interview with questions that they want to ask you. And then they're going to control the environment. They're going to set the stage of where you're going to meet. Is it going to be a panel interview? Is it a single interview? They're going to clarify the roles, especially if it's a panel, who's going to ask what questions, who's going to introduce. And then you may also clarify the roles with the interviewer. What are their expectations for this position? You're going to use good listening skills as an interviewer, and be honest. When they ask you a question, you want to be upfront and honest, and provide a closure at the end and tell them when you will get back with them. As an applicant, you arrive on time, and on time is usually 15 minutes early. You're going to be dressed appropriately. You're going to review the mission and the goals of that organization. Remember, we've talked about that a couple of times. You're going to look at the position and the description, what's expected of you, so you can ask appropriate questions. So prepare your questions in advance. Have a list of questions. In case they already answer one, you can mark it off and you still have questions left. Be honest. And send a note at the end afterwards of appreciation for the interview. You can send it as an email, as a quick one, but it's also good to also send a thank you note in the mail. This is just an example how some nurses may be evaluated on a Likert scale, and so they may have this, and they go through and they talk to everyone, and they kind of see where you fall on that scale when they're doing your interviews. I'm not going to read all this to you, but these are key behaviors when you're going for a performance behavior appraisal. Key performance behavior. Oh my Lord. Key behaviors for a performance appraisal. Again, it needs to be an area where there's not a lot of distractions, where you can be relaxed. Make sure they feel comfortable when you're doing the evaluation, because many people are nervous, and if you've been to an evaluation, it is a little bit nerve-wracking. Look at, review the good and the bad, the positive, negatives. Allow them to express their opinions. Write future plans and goals and training for that person, because remember, we just don't stop there. How can you help them to expand their horizons? Set a follow-up date to make sure things are still going well. Show them that you're confident in them as an employee, and always be sincere. And if you do have to speak to them about issues or some things that might be on a little bit shaky ground, be constructive, not destructive. The last thing I want to go about is empowerment strategies. Any good manager is going to empower their nurses, and that's empowering them with responsibilities, professional development such as education, conferences, seminars, committees, and helping them to go on and beyond where they are now, and to help them keep building and growing as a nurse. All right, that's all I have, and I'll see y'all in class.